Hello everyone, how's it going? You know, thyroid nodules are very common. Actually, by age 60, about half of people have a thyroid nodule. Well, is this something that we should be concerned about? Are there symptoms we should be looking out for? And are there some people who might be more at risk? Well, if that sounds interesting to you, then keep watching. Now, thyroid nodules are actually solid or fluid-filled lumps that form within your thyroid. They're actually quite common. Now, while most of thyroid nodules don't actually cause any symptoms, there are sometimes people, they actually do get some concerning symptoms, and we're going to talk about that in a little bit. But I thought it was interesting that since they don't usually cause any symptoms, most people don't even know that they have a thyroid nodule until their doctor actually discovers it during an exam, or they're out getting a scan for some other reason. Well, should we be concerned about these thyroid nodules? Well, most thyroid nodules are really not serious. In fact, more than 90% that are found in adults are benign, so they're not even cancerous. However, even if they're not cancerous, it is possible that they could be a sign of and or a cause of a thyroid disorder. Now, fortunately, even if they are cancerous, they generally tend to be very slow growing. But still, thyroid cancer, just like any cancer, it's best to have it evaluated sooner rather than later. So even though there aren't usually any symptoms, there are sometimes thyroid nodules that can actually become large enough to be visible. They can actually be felt. Some are actually so large that they actually could compress on the esophagus or the windpipe. It can actually make it difficult to breathe or swallow. Now, for some people, they may just get like a tickle in their throat. Now, more rarely, it can actually cause pain in the neck, the jaw, the ear. For some people, it could cause hoarseness, so they might actually have voice changes. Now, most nodules, even those that are cancerous, are non-functioning, so that means you could actually have a thyroid nodule, get some thyroid blood work, and actually it could come out, all your levels could be normal. But on the other hand, there are some nodules that can cause an overproduction of thyroid hormone, which could cause someone to have hyperthyroidism. Now, some symptoms to look out for when it comes to hyperthyroidism would be unexplained weight loss, increased sweating or appetite, nervousness, rapid or irregular heartbeat, diarrhea or frequent bowel movements. For females, light or missed periods, menstrual periods. Now, thyroid nodules can also be associated with low thyroid hormone, so someone might actually wind up with hypothyroidism. Now, some symptoms of hypothyroidism would be feeling cold, tired more easily, dry skin, memory problems, depression, constipation, weight gain. For females, frequent or heavy menstrual periods. Now, before we talk about who might be more at risk, I'd like to just remind you to please like and subscribe if you're enjoying today's video. Also, just a reminder to open up the description box below. There'll be always some links there that are very helpful where you can get more information. And if you have a comment you'd like to leave on this topic, make sure you leave that below as well. Okay, so who would be more at risk? Well, thyroid nodules are actually 4 times more common in females. Also, those with iodine deficiency would be more at risk, but that's pretty rare for people living in the United States. Those with a history of thyroid radiation, if you have a family history of thyroid nodules or thyroid cancer, obviously as we get older, that increases our risk. Those who have iron deficiency anemia, smoking, obesity, and alcohol consumption also can put someone more at risk. If you have uterine fibroids or a metabolic syndrome, that could put you more at risk. Now, those who have Hashimoto's thyroiditis, that's the most common cause of hypothyroidism. If you have that condition, that is also associated with an increased risk of getting thyroid nodules. Now, researchers really don't know why thyroid nodules form, so it's not like we can try to prevent them, but we can manage risk factors, some such as obesity, smoking, and making sure we're getting enough iodine in our diet. Now, although an aggressive thyroid cancer is very rare, it's really best to have a doctor evaluate any unusual swelling you have in your neck, especially if you can feel something that feels large, if it's hard, or if it's causing some pain or discomfort, especially if it's causing any trouble with breathing or swallowing. Now, your doctor may decide to order a thyroid blood test, possibly a thyroid ultrasound. Sometimes they'll order a fine needle biopsy or a thyroid scan. But if the thyroid nodule is actually benign. It's not causing any problems. Sometimes the doctor will just keep an eye on it. They'll check it, do an exam once a year. Sometimes they'll even do an ultrasound every 6 to 12 months. But the good news is that most thyroid nodules don't even need any treatment. And even if it does turn out to be cancer, thyroid cancer is actually one of the most treatable kinds of cancer. Well, I hope you have enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.